In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
To learn more about the different kinds of eating disorders, we have an expert in our studio today, Professor Michael Kölsch. He is a child and adolescent psychiatrist and specialist for eating disorders from Berlin. Hello, welcome to the show. Hello. Doctors are constantly pleading to eat more healthily. So when does it become a disease or disorder?
Yes, it becomes a disorder if you are obsessive in your thoughts about eating and you neglect all other interests, or if you're a father or mother, you influence your child in only eating healthy food, and then it may be a disorder.
So it's not only me eating more healthy food, it's even my environment or my direct family?
Yes, yes.
But it feels good for the patients, doesn't it, to eat healthy?
Yes, it feels good, but if they neglect their social life or if they have a loss of their family, then it doesn't feel good anymore.
So it doesn't fit into the daily life then. Yeah. So what is the cause of this disorder? Do you know anything about the causes?
There's no one single cause of this disorder, but sometimes people have a little bit an obsessive compulsive personality, or some people have some severe life events after a severe somatic disease. They develop such a behavior. Or sometimes it's just an overwhelming interest for healthy food, and then it's like an automatism.
So even if there's no single cause, but there are some severe consequences to the health and to the well-being?
Not for well-being. Normally, if you eat only healthy food, there must not be any consequence, but there can be a very severe consequence for your everyday life or for your social life then.
So some specialists don't even recognize this disorder as a disease. They say perhaps it's a normal kind of behavior. So what's your personal opinion about that?
Yes, I would be very reluctant to define this disorder as or this behavior as a disorder, psychiatric disorder. We have to check, is there obsessive compulsive disorder or something like that? But at the moment, I would not define this as a psychiatric disorder for itself.
So, but the underlying disorder would be an eating disorder, wouldn't it?
Yes, it can be an eating disorder, but it can also be an obsessive-compulsive disorder or some personality disorder.
And are there some psychological causes that orthorexia may stem from?
We don't know this causes at the moment. It would be very speculative to say this is the cause for this. But what we can observe is that this behavior is more common in industrialized countries and not so in other countries of the world.
So and if I think I would suffer from orthorexia or some of my family members would suffer from this kind of disorder, then who's the expert to see?
Yes, I think a psychotherapist or a psychiatrist which is specialized in eating behavior or eating disorders.
Dr. Kölsch, when is someone just plain skinny or a little bit picky about nutrition, and when is someone really anorexic?
Yes, if you have a weight loss of about 15% of expected weight, or if you have some purging behavior using laxantias or something like that, and if you have some wrong perception of your body shape, feeling fat. If other people say you are very thin and you feel fat, then you should think about an eating disorder or about anorexia.
And is it all about the fashion industry? I mean, sometimes patients just blame it on the fashion industry. All the models being so damn skinny, all size 0. Or does the fashion industry doesn't have anything to do with it?
No, I think it has an influence, but it's not the single or the all of the story. The beauty ideals of young girls influence the development of an eating disorder, but without any fashion industry, we would also see some anorexia patients.
Yeah, and you say young girls. So young girls are the main patients affected by anorexia. Are there old girls or old men affected by this as well?
Very rare, very rare cases. Mostly young girls, and even much more younger girls than 10 years ago, suffer on anorexia, 10-year-old girls or 8-year-old girls. But you can also develop in later life anorexia, but this is very seldom the case.
So how can you tell that a patient is anorexic and that he's not just thin? Are there any tests?
No, there is no test. We have to speak with the patient, we have to speak with the family, we have to look at the eating behavior. Is there some avoiding of some special food? Is there forbidden food or something like that? There is no test, but we have to do the anamnese of the family, and then we can say, okay, this seems to be an eating disorder, this seems to be an anorexia.
And for the non-professionals inside the family, are there any warning signs that perhaps the daughter is anorexic?
Yes, if your daughter don't join your common meals at home, if your daughter makes excessive sports or something like that, and feels fat, and you think she's not fat, this could be warning signals for developing an anorexia.
And me as a father, should I just approach my daughter and say, perhaps you've got a problem, an eating disorder, or what's the best way to approach those patients?
You should not say you have an eating disorder, but you should ask the daughter, is there any cause why you don't eat with us? Do you feeling fat or something like that? And then you can seek help by a specialist.
And should all anorexic patients see a specialist and get some treatment there?
Yes, normally yes, because the disorder does not disappear without help, and therefore help is necessary for these people.
And what is the prognosis, the long-time prognosis overall?
Yes, it's a severe disease, but about a third of patients will have no problem in later life and will recover. About a third of the patients maybe have some symptoms if there are life crisis later or something like that. And about a third of the patients will have a chronic course of the disease.
Okay. Dr. Kölsch, thank you so much for being with us in the studio. Thank you.